The health watchdog Monitor has announced that the trust that runs Stafford Hospital is to be put into administration.
It's the first NHS Foundation hospital ever to be placed under the measure. Callum Watkinson was there today to hear the announcement. Callum, what more can you tell us?
Well, in February we had Robert Francis's report into how hundreds of people had died needlessly here. Just last week we were reporting that the first criminal investigation into one of those deaths is now underway, and then today we have the news that this trust is to be placed into administration. Now, that doesn't mean the same as it does when a company calls in the administrators, but it does mean that as of midnight tonight, the trust and governors will be suspended and the administrators will take over.
The fact that the board and the governors are suspended is in no way a criticism of those individuals. This is simply the way the process works. Nor, I should say, is it in any way a consequence of the report just published by Robert Francis. That, of course, was looking at what happened now many years ago.
So, Callum, you've mentioned there what happens to the governors, but what does it mean for staff and services?
Well, this all goes back to a report for Monitor back in March, which recommended that certain services should be discontinued here, acute services and maternity services amongst them, and that slack taken up by other hospitals. Now, that doesn't necessarily mean that those recommendations will be contained in the final proposals of these administrators, but nevertheless, I think you can understand why those campaigning to keep acute services here unchanged are concerned by this news today.
In the local health economy, we know that the hospitals around us aren't coping. We know that Stoke themselves have got a capacity problem. They've had to reopen beds. They're not meeting their targets, which they're being fined for. The same can be said at Walsall, Wolverhampton. Burton's under pressure. It admits it's about to crack. Taking 300 beds plus beds from Stafford and pushing out is not the answer. We are going to cause other areas to fail.
And they'll be marching through Stafford to show their support for this hospital on the weekend. But it's not just the local people here who are concerned about the effect losing acute services might have on other hospitals in the area.
The demand for acute healthcare in the region is rising all the time. The pressures on other hospitals in Stoke, in Wolverhampton, in Walsall and Burton are rising. There is no capacity there. We know that an acute hospital at Stafford is an absolute must.
Well, the administrators now have 45 days to table their proposals. There will then be a 30-day public consultation period, and there'll then be a 10-week review period, at the end of which the Department of Health will decide which, if any, of those proposals to enact. So we are at least 150 days away from anything actually being changed here. During that time, the administrators will run the hospital day to day, and they were at great pains to point out that throughout that period, services and staffing will remain unchanged here.
Callum, thank you for that report.